Hi, I'm Renato Lopes, cardiologist from Duke University in Durham, North Carolina. I think in the last 2 years, we've made tremendous progress in the COVID field because at the beginning of the pandemic, everybody was treating patients based on no high quality evidence, on several potential and mechanistic studies and observational studies trying to do something for patients. And we know that this can be very dangerous because we don't know if something really works or not. But I think the scientific community was able to really bring along amazing and well-designed studies in different fields and really create a lot of high-quality evidence very rapidly, that in 2 years now we have a much better sense of what works and what does not work for patients with COVID-19. So in this sense of bringing up high-quality evidence, the Apollo trial, I think, is another piece for this puzzle of the role of anticoagulation for patients with COVID-19. Of course, we learned that patients are at different risks for thrombotic events if they are out of hospital, if they are in the hospital, if they are in the hospital but in the ICUs, or even when they go home. There are different risks of these patients having thrombotic events, and different studies look at different strategies on how to minimize these risks of thrombotic events. Particularly in the outpatient setting, we didn't have a lot of high quality data. We have some randomized trials, and what the Apollo trial did is really try to test low dose Apixaban, 2.5 milligrams twice daily, versus placebo in a double-blind placebo-controlled trial in patients who have COVID but are not sick enough to go to the hospital, so they are at home being treated with symptomatic drugs and but at increased risk for thrombosis, so with elevated D-dimer or other classic risk factors for thrombotic events. So that's what the Apollo trial wanted to answer. And what we showed is that when you treat these patients with low dose Apixaban, it did not improve in general outcomes, and it did not have an impact in the number of days alive and out of hospital at the end of 30 days. So basically giving high quality evidence that we don't need to routinely anticoagulate patients in the outpatient setting when they have COVID-19. Yeah, so I think Apollo is another piece to the puzzle. There have been already some studies demonstrating that there is no benefit of using anticoagulants, different types of anticoagulants for patients with COVID out of the hospital, patients with COVID that don't need to be hospitalized. And I think Apollo brings and confirms this data now with a different agent, Apixaban, in a different dose, 2.5 milligrams twice daily, which is a lower dose than the classic full dose Apixaban. But again, with the results aligned with the other pieces of data that we have so far in the outpatient setting. Well, I think COVID continues to change, different variants and different aspects, and I think we're going to continue to learn about COVID and having to be very smart and fast in designing trials to try to answer the questions that we need in each given time of the infection.